So this is Christine. She was sent to me for a shoulder replacement and instead decided to do PRP injections. And so Christine, tell us your story here.
Okay. Hi. I have been very, very pleased. The pain has subsided. I can't tell you how great it is not to live on estrogen, Tylenol, or just have to be a certain way to not feel the pain. It's not totally gone, but it is got to be 80% better than what it was. It's truly a blessing.
Great. And as we know, you should continue to notice improvements in the pain until about 6 months out from your first injection, even maybe a little past that. And again, when I saw you, the question I asked you, is it pain or is it function? And we know your shoulder doesn't function very well, but you chose to try to avoid the pain and avoid the surgery. And so thankfully, the pain is much subsided. You're able to sleep through the night, yeah?
Yes, I'm sleeping through the night and everything. I have no pain at all when I'm sleeping.
Great.
None.
And so
I can even lay on this shoulder.
Great.
And it doesn't bother me one bit.
Great. And so far, you're happy you're avoiding shoulder replacement surgery?
Oh, yes. Yes.
Great.
My brother had shoulder replacement, and he went through you know what.
Yeah.
And he said to me, don't get it. And I'm glad that I met you.
Yeah, and I do both. So people get shoulder replacements and they do well when they need to, but certainly that's why I asked, was it pain or function? If you told me it was function, there's nothing that I could do to get your arm to nearly as well as I could do it with a surgery. But pain-wise, PRP does great. So thank you so much for your story.
Okay, thank you.